Welcome back. You're with Newsday. As we just heard from the AMA president, doctors are warning about an increase in hospital admissions for patients suffering from COVID as the nation does open up. Elective surgeries could be reduced and patients turned away unless health funding, they say, is overhauled. Joining us live is Natasha Robinson, the health editor at the Australian newspaper. Natasha, where are we at in terms of the expectations as to how the health systems, particularly in New South Wales and Victoria, are going to cope as we do see opening up continuing? Are epidemiologists, are the staff in the hospital system, are they getting really worried, or is there a sense that they've got this under control?
Yeah, look, I think healthcare workers in general are very apprehensive. They've been on the front line for over 18 months now, and it's been a very hard slog with them for them. So the feedback that I get is that they are feeling very apprehensive. But there's obviously a wide divergence of opinions among epidemiologists, but I think what we're seeing in New South Wales is very encouraging. The vaccination rates are climbing all the time, and the closer that we get to 90%, over 90% fully vaccinated, it's just exponential, the impacts of how this will actually affect our healthcare system and those impacts on the spread of the virus, and also the proportion of people who are sick. And of course, in the older age groups, we've seen vaccination level coverage first dose of above 95%. So it's an incredible response. I do think it augurs very well for how our health system will cope. But as you just heard from the AMA, it is an incredibly overstretched health system already, and the burden of COVID is going to be very significant. So the estimates on how much that burden will actually be very wide in terms of whether we see a low-level kind of spread of the virus or whether we see a high-level spread of the virus. And the modelling from the AMA suggests that kind of divergence between a low-level spread and a high-level spread will be kind of in the order of demand on ICU beds being only 5% extra in the low-level scenario versus about 47% extra in the widespread spread and high case number scenario. And the number of hospital beds that they're predicting that will be occupied by COVID patients on any one day, and remember this is just one day, it will range anywhere from between 400 to about 2,400. So it is going to be an extra burden on the health system, which will probably be a permanent thing. And I think that's why the funding debate is heating up so much right at the moment.